Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, we're going to discuss baldness and hair loss, be it partial or complete. The umbrella term for all of these hair loss conditions is alopecia. And many people think of hair loss as something that comes naturally with age, but as we will see, there are many possible causes for hair loss. It can indicate serious underlying health conditions. So let's look at all of the possible causes and natural solutions that can help you. We all have some kind of emotional relationship with our hair, whether we wear it long or short. A certain amount of time goes every day into grooming our hair. It is through the course of this everyday habit that people first notice that the hair starts falling out and other changes take place in the scalp and the hair. Thinning hair is often worrisome since it is the first step, amongst many others, that can lead to permanent hair loss and baldness. However, the thing about losing your hair is that it happens a little bit by bit every day, so you don't notice it necessarily immediately. An average adult head has about 100,000 to 150,000 strands of hair. And out of this, it is normal to lose about 50 to 100 every day. The problem of hair loss and thinning of the hair begins when the phase of hair growth does not keep pace with the degree of hair loss. And to understand this more, it is essential to investigate the life cycle of our hair. So, what are the phases of hair growth? There are different phases, including the so-called anagen, catagen, telogen, and exogen phases. After the completion of the last stage, the entire cycle is repeated, and each hair undergoes these three growth phases independent of the other hair on the scalp. In the anagen phase, also known as the growth phase, that lasts 3 to 5 years and is also known as the active phase, the hair roots divide rapidly and this results in hair growth. Around 85% of the hair strands are in this phase at any given time. Then we have the so-called catagen phase, also known as the regression phase. Around 1 to 3% of the hair is in this phase at any given time, and it lasts approximately 10 to 20 days when the hair strands stop growing. Then we go into the telogen phase, also known as the resting or shedding phase. Approximately 10% of the hair is in this phase at any given time, and this phase lasts for around 3 months, after which the hair falls out. And then in the exogen phase, this is essentially an extension or part of the telogen stage of hair growth, and during this stage the hair is shed from the scalp, often helped by washing and brushing. We lose 50 to 100 inches per day during the exogen phase. This is normal, and this phase can last about 2 to 5 months. And new hairs grow in the follicles as old hair falls away. Hair loss is not an issue if the hair continues to regrow at the same speed as it falls out naturally. However, when the hair shedding phase goes on at its own pace, but the growth phase or the anagen phase is shortened, then less hair grows at a given time in this short period, while more hair continues to be shed at the same time, and in such cases, hair loss becomes visible and requires proper treatment. Let's also look at the skin. The skin consists of two main layers, the epidermis, also known as the outer skin, and the corium skin, also known as the dermis. The function of the relatively thick dermis is to protect the organism against injury and attacks. The corium skin is mainly composed of melanocytes, which are the cells that make the pigment called melanin that gives color to the skin and hair. Melanin is also produced, by the way, in your iris, in the eye, and the ciliary body of the eyes. In addition, melanin acts as an effective light absorber to shield the skin from UV radiation. Now, embedded in the dermis are sebaceous glands and sweat glands, and in evolutionary terms, the corium skin developed with the pleura, the peritoneum, and the pericardium. The corium skin, including the sebaceous glands and sweat glands, originates from the old mesoderm and is therefore controlled by the cerebellum. In the cerebellum, the corium skin, including the sebaceous glands and the sweat glands of the right half of the body, is controlled from the left side of the brain, and the corium skin of the left half of the body is controlled from the right brain hemisphere, and hence we have a crossover correlation from the brain to the organ. The biological conflict that can cause problems with the skin is, according to its protective function, conflict that is linked to an attack. An attack conflict is experienced, for instance, through an attack by a person or an animal, or a hit or a blow against the body or the head, as you might experience, for example, in sports or in a fight or an accident. Medical procedures such as surgery, needle biopsy, injections, vaccinations, stabbing or piercing pain could also be registered as an attack. And on top of that, verbal attacks, for example, being yelled at, scolded, assaulted, or threatened with sharp and aggressive words, typically hit the face, the forehead, an insult against your intelligence, for example, or the back, when you feel that you have been stabbed in your back. Also, sexist remarks, sexual accusations, or attacks against one's sexual orientation can strike below the waist. So hearing offensive words affects your corium skin of the ear. Being criticized in a hostile manner, being discriminated against, defamed, or an insult against your integrity could impact the whole body. A skin condition such as acne or surgical scars on the face or the body after a mastectomy, for example, can also evoke a so-called disfigurement conflict that also corresponds biologically to the corium skin. When it comes to the epidermis, so your outer skin that covers the underlying corium skin, it is predominantly responsible for sensory perception such as temperature, pressure, and touch. Most cells in your epidermis are keratinocytes, so keratin-producing cells that originate in the deepest layer of the epidermis called the stratum basal. This layer also contains pigment-producing melanocytes, which are most melanocytes that are in the corium skin, and from the basal layer the keratinocytes migrate through the stratum spinosum and stratum granulosum up to the stratum corneum. And once they reach the skin surface, they are gradually shed and replaced by newer cells that are pushed below. Keratin is also the main structural component of your hair and nails. The epidermis consists of keratinized squamous epithelium that originates from the ectoderm and is therefore controlled from your cerebral cortex. The epidermis is controlled by the sensory cortex, which is part of the cerebral cortex. For example, the skin of the right side of the body is controlled from the left side of the sensory cortex, and the right hemisphere governs the left side skin. Hence, again, we have a crossover correlation from the brain to the organ, and the biological conflict that is linked to the epidermis is a separation conflict that is experienced as a loss of physical contact. In line with evolutionary reasoning, territorial conflicts, sexual conflicts, and separation conflicts are the primary conflict themes associated with organs of ectodermal origin controlled by the sensory premotor or postsensory cortex. A separation conflict pertains to wanting to separate from something close to the skin, as for example, a face mask can be, or an oxygen mask, or a helmet, hat, clothing, shoes, tight stockings, wet linen, diapers, etc., etc. The same applies to a separation from something that one is no longer allowed or able to touch, such as a musical instrument that you love, keyboard, a tennis racket, your golf clubs, the steering wheel of your car that you love, etc. Separation from home is not a separation conflict in biological terms, since it does not relate to the skin, but concerns your territory. All psychosomatic conflicts, which are a possible cause for all conditions, including partial and complete hair loss and baldness, we have a conflict active phase and a healing phase. During the conflict active phase, the epidermis ulcerates at the areas associated with the separation, and ulcerations are microscopic and therefore usually go unnoticed. However, with continuing conflict activity, the skin becomes dry, rough, flaky, pale and cold from poor blood circulation. And eventually it begins to crack, causing thereby fissures that may even bleed. If an intense conflict persists for an extended period of time, the skin opens at the ulcerated areas. Ichthyosis, a skin condition characterized by fine scaling, where you have scales like small fish scales that develop, can also indicate long and intense conflict activity. A severe form of ichthyosis is termed the Netherton syndrome, and this is assumed to be a genetic disease. On the scalp, the flaky skin shows up as dandruff. Additionally, deep ulceration of the epidermal skin causes hair loss or alopecia, and this can also happen in pets. In the example that you see here in the picture on the right, you notice that the bald spots are exclusively on the left side of the scalp. And this reveals that the loss of physical contact is related to a partner if the man is left-handed, or to his mother if he is right-handed. With the resolution of the conflict, the hair starts growing back again. Because of the loss of epidermal cells, the skin's sensitivity decreases, and if the separation conflict is severe, the skin can become completely numb, also known as sensory paralysis. Sudden sensory numbness, for example of an arm or a leg, is often confused with a stroke. A brief reactivation of the sensory paralysis arises during the healing phase. A typical symptom of the conflict active phase is also short-term memory loss, which serves the purpose of temporarily forgetting the one who was torn from the skin by blocking out the memory. In the animal world, the mother cat does no longer recognize her offspring when they are separated from her too early. This is the same thing that happens with us. Short-term memory loss reaches into the first part of the healing phase. And in children, poor memory shows up as learning difficulties and focusing problems, nowadays labeled as ADD. In adults, long-lasting separation conflicts can lead to dementia. Short-term memory loss occurs during any biological special program in the conflict active phase and the first healing phase, involving the sensory, post-sensory or premotor sensory cortex because, in biological terms, the squamous epithelium of the entire organism is associated with a separation conflict. During the first part of the healing phase, the ulcerated area of the skin is replenished through cell proliferation, and as a result, the skin can swell up, become red, inflamed, irritated, or itchy, and sensitive to touch. A small fluid-filled edemas may also appear as blisters, but those eventually dry up and the skin normalizes, provided, of course, no conflict relapses. The healing of the skin manifests also as a skin rash, termed dermatitis, or as eczemas or hives. Often it is diagnosed as measles, rubella, chickenpox, rosacea, lupus, psoriasis, herpes, and other skin conditions. Those can all be, however, symptoms of the healing phase of a separation conflict. With all chronic health conditions, including hair loss and baldness, we have to look holistically at all the possible causes, and the biological conflicts that we have discussed are just one of them. So let's go next through a list of other causes for your hair loss. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. For the holistic healthcare you need and deserve, please do not hesitate to contact us at christine.doctor. We will remotely evaluate the real causes of your health condition holistically and develop, in conjunction with you, a customized natural therapy plan that works. And also, check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links, as always, also in the description box below for you. Alright then, what are some other possible causes for hair loss? Well, there are many health issues that can cause it, such as hormonal changes, emotional or mental stress. That happens very often, by the way. Changes or in your environment, the quality of the water with which you wash yourself and which you drink, your diet, etc., etc. So, some of the most common ones. Thyroid problems. They can cause hair loss in severe and prolonged cases. Hair loss due to the thyroid can be treated once the underlying hormonal imbalance is fixed, but it can take some time for the hair to regrow. Hormonal changes can cause hair loss, including those that occur after childbirth, during menopause, when you suffer from hypothyroidism or polycystic ovarian syndrome. Emotional trauma that cause constant stress or grief from losing a beloved family member or close friend can lead to hair loss. Nutritional deficiencies and anemia due to a poor diet or some other underlying health condition that prevents the absorption of the nutrients that you take in can also cause hair fall. Here it is recommended that you supplement with iron, zinc, certain proteins and vitamin B3 to help the absorption of the nutrients. Recovery from acute fevers like typhoid fever may also lead to diffuse hair loss. Alopecia areata can also cause hair loss in spots. This condition is a very common cause for hair loss in young people under 20 years of age and is also commonly found in people with thyroid problems. Certain drugs, like the ones that are used to treat high blood pressure or joint pains, cancer or depression, can also cause your hair to fall out as a side effect. For example, anagen effluvium refers to a condition of hair loss that is caused by chemotherapy in cancer patients. Chemotherapy drugs that are used in these cancer treatments damage their hair follicles, and this leads, of course, to hair loss that you observe very often in cancer patients. Physical traumas and injuries to the head can also lead to hair loss in some cases, as well as general diseases like diabetes mellitus, tuberculosis, or AIDS. And they tend to cause hair loss due to the decreased immunity and nutrition in the body. On top of that, certain hairstyles, believe it or not, like tight braids or ponytails, where the hair is tightly pulled back, can also lead to so-called traction alopecia. Additionally, indiscriminate use of chemicals, meaning hair colors, and heating tools can damage the hair and lead to the loss of it. Trichotillomania, which is a mental disorder in which the affected person voluntarily pulls their hair out, can of course also lead to it. And we all know that male balding, because it's very visible, is a common problem, especially as men age. Many tend to feel a little bit isolated when they suffer from it. According to statistics, 40% of men undergo noticeable hair loss by the age of 35, but it is not a condition that is specific only to men. Women suffer from hair loss as well. It is often not that visible though. On top of that, many scalp conditions can lead or contribute to hair loss. Some of the primary scalp conditions that are associated with hair fall include tinea capitis, lichen planus, eczema of the scalp, scalp folliculitis, and dandruff. Fungal infection of the scalp called tinea capitis is a contagious scalp infection. It can spread from person to person or by sharing objects like towels, combs, and hairbrushes. Its main features are itchy, scaly patches on the scalp, which tend to enlarge gradually. Blisters may also appear that ooze out fluid. Additionally, the hair in the affected area gets brittle and breaks, so bald patches on the scalp tend to develop as a result. Lichen planus is an autoimmune condition that affects the skin, the hair, and the mucous membranes. It leads to flat-topped purple-colored papules on the skin. And in cases where the lichen planus involves the scalp discoloration, hair loss can also be noted. Eczema of the scalp is an oily, inflammatory condition that goes along with flakiness and dandruff, and it mainly affects the scalp. Itching and burning of varying degrees may appear. The flakes tend to clog the hair follicles and hinder hair growth thereby. Additionally, the hair may stick to the oily bits, and it tends to fall off when you scratch this area. And hair loss therefore becomes an associated condition with the eczema of the scalp. Apart from the scalp, other areas like the face, the eyelashes, the ears, and chest can also be affected. Scalp folliculitis is an inflammation and infection of the hair follicles of the scalp, and it may result from a bacterial infection, a fungal infection, or overproduction of sebum that clogs the hair follicles on the scalp. The features of scalp folliculitis include pimples or pustular eruption on the scalp. In addition, there may be yellowish or clear fluid oozing out from these eruptions, as well as itching, burning sensations and pain that accompanies the hair loss. Dandruff is a scalp condition wherein flakiness on the scalp is present along with itching. And dandruff does not cause hair loss directly, but the itching and scratching of the scalp can lead to the hair loss. As you can already see, there are many possible causes for hair loss. That's why we recommend that you discuss your problems with hair loss with your trusted healthcare practitioner. We, of course, at Christine.doctor, as mentioned, can also help you to find the underlying causes for your hair loss and develop a natural holistic therapy plan. So please contact us. As mentioned, link is in the description box below. For the scope of this presentation, we cannot go through all of the natural treatment options, but I'm going to mention some of them that are really great, starting with some homeopathic remedies. Phosphorus, it's great for excessive hair loss in bunches. It's the best medicine when the hair falls out excessively in big pieces. Hair fall mainly occurs from the head's forepart, also in this case, and the phosphorus helps to control the hair loss and stimulate hair growth really, really well. Persons who require this medicine may have dry hair. They may also suffer from dandruff and an itchy scalp. It is also a prominent medicine for premature graying of the hair, and it can be used in a dilution of 30C potency twice a day. Next, we have Fluoricum acidum. This is great for hair loss in spots, also known as alopecia areata. It prevents further progression of the hair loss and promotes hair regrowth in the already present areas. It is also a great medicine when hair strands are brittle and dry and tend to break off easily. It helps in decreasing dryness in the hair and thereby preventing hair breakage. And lastly, it is also the best for controlling hair loss after fever, particularly typhoid fever. Though it can be used in different potencies, but it is recommended that in the beginning you take it in a 30C potency twice a day. Next we have Wiesbaden Aqua for hair regrowth. It is a natural remedy to aid hair regrowth. It is sourced from the springs of Wiesbaden in Prussia, in Germany, and this medicine is known to aid the quick growth of hair. It also helps make the hair more dense and darker in color. Additionally, it nourishes the hair roots and makes hair healthy and strong, and the potency suggested is 30C again. Take it twice daily. Phosphoric acid is great for hair loss from grief and sorrow. Those that need it experience marked thinning and falling out of the hair. They may have also early graying of the hair. It is also valuable for treating hair loss that occurs in the beard area, and it gives excellent results when taken together with phosphoric acid, again in the 30C concentration twice daily. Thallium met is for hair fall after acutely exhausting health conditions. For example, a very severe flu, a throat infection, or prolonged fever. The hair loss is relatively rapid in the cases that need thallium met, and it may be also general hair loss all over the scalp or in spots. And the hair comes out in handfuls in these cases. Again, the recommended potency is 30C once a day. The homeopathic treatment for baldness and hair loss is a more gentle and conservative form of treatment compared to conventional treatments, which involve the use of drugs like minoxidil and finasteride, and other methods that are very invasive like hair transplants or hair scalp microneedling. Minoxidil works by stimulating the hair follicles and is said to help regrow hair, but it can have side effects like unwanted body hair, irregular heartbeats, allergic drug reactions like rashes, swelling of the throat, of the face or tongue, and dizziness. Finasteride is another common drug that is used to treat inflammations in the prostate glands by reducing the production of DTH, but it also helps decrease the rate of hair loss. Its side effects include allergic reactions like hives, swelling on the face, and difficulties breathing. However, impotence and loss of interest in sexual activity are other severe side effects, and this, if they develop, tend to continue even after you stop taking this medicine. Homeopathic treatments, on the other hand, for hair loss work by targeting the root cause, whether it is the hormonal problem or a disease. Homeopathic medicines are effective to prevent further progression of hair loss in a gentle way. In early stages, regrowth of the hair can occur, but it varies from case to case. There are certainly no side effects with homeopathic treatments, and this makes them, in our opinion, a very effective and desirable option. Male baldness is linked with male sex hormones or androgens, including testosterone and dihydrotestosterone. These androgens help in the development of the male sex organs and other male characteristics, including the deepening of the voice, the increase in the muscle and bone mass, sperm production, controlling the sex drive, and growth of body hair, including facial hair. The change in the levels of these hormones results in shrinking of hair follicles and a shortening of the growth phase of the hair, so the anagen phase that we've discussed, and those two factors result in hair loss. Hair follicles are a pouch or sac that is found under the skin from which a hair strand grows, and a person on average has about 150,000 hair follicles on their scalp. In case of male pattern baldness, due to the shrinkage of the hair follicles, either short, thin hair growth, or a stage comes when no hair grows at all anymore. And male pattern balding is the result of many interdependent factors. The factors can be hereditary, or they can stem from lifestyle choices. And in some cases, underlying health conditions, such as the ones that we have discussed, can also indirectly induce the hair loss. It is common knowledge that male pattern baldness is inherited from the mother, and this is true because the baldness gene is present on the X chromosome, so the female chromosome, so it is the woman who passes it on. This hereditary factor is dominant on the maternal side, which means that even if the father has a head full of hair, the son unfortunately may still experience male baldness at even a young age. And this is especially so if the mother's brother has a receding hairline. However, the male pattern baldness gene gets passed on to the next generation from both sides of the family. It may even skip a generation. Even within the same generation, one male child may have thick hair while the other may suffer from a receding hairline. So, yes, it increases the possibility of baldness in men, but it's not a necessity that you will lose your hair because the maternal side has this problem in your family. The homeopathic remedies that we've discussed already are great for both men and women, but there are some homeopathic remedies that are specifically designed for female baldness, such as sepia suckers. It's the top homeopathic remedy for female pattern baldness. In the menopausal stage of your life, sepia suckers has been successfully used to treat female pattern baldness that often develops during this stage. The scalp is often painful to the touch. The roots of the hair seem sore, so again you feel pain when you touch them, and you are very sensitive to combing. Additionally, pimples can be seen along the margin of an itch on the forehead, and therefore it can be used, sepia suckers, I mean, to manage hair loss in females in the menopause. Suggested dose is 30 C again concentration, and you take it once a day. Then we have naturalremedies for women who experience hair loss after childbirth. This can be really great. In these cases, along with the hair loss, the women often experience severe headaches after child delivery, and the hair loss may be noted at the slightest touch on the scalp. It is also often marked at the sides and the forepart of the head, and dandruff with white scales may be also present on the scalp. It is the best prescription for managing hair loss in women after childbirth, and again, take it at 30 C potency once a day. Numerous studies have proven that the degree of relationship in terms of family history also increases the severity and patterns of baldness. For example, a person whose father or siblings or first-degree relative is bald is more likely to undergo moderate to severe baldness than someone with more distant relatives facing baldness. The former are 13 times more likely to have baldness than those with no family history. And according to recent research, the prevalence of baldness increases with age. Comparing people who have never smoked and those who are smokers or who have quit gave also exciting results. Current smokers, or those who have left, are almost twice as likely to experience moderate to severe hair loss. Further, a comparison between current smokers who smoke less than 20 cigarettes a day and those who smoked earlier but have quit has shown that they are not at an increased risk of baldness. The intensity of smoking, therefore, is also related to the likelihood of baldness. Smoking, on top of that, has, of course, many other adverse effects on many organs in your body. It leads to poor blood circulation, oxygen saturation in your cells, and the lack of essential nutrients that gets to your cells. And this can also result, of course, in hair and scalp problems. And the chemicals found in the tobacco, and there are hundreds of them, are of course toxic and can also damage your hair follicles. So, best if you give up smoking. Male pattern baldness is also linked to the consumption of alcohol. The main reason why alcohol harms your body and aggravates baldness are that it leads to the consumption of empty calories. As a result, a person who drinks alcohol may feel full and too full even to eat a real nutritious meal. And this, of course, results in a lack of nutrition to the body, which can aggravate baldness. Then, a lack of a well-balanced diet can lead to the deficiency in vitamins like vitamin B1, also known as thiamine, that is essential for hair growth. And alcohol also contributes to hair loss by damaging the stomach lining and the liver, which increases the production of acid in the digestive system, and this makes it difficult for the body to absorb the nutrients properly. Excessive drinking also has a diuretic effect, due to which the levels of magnesium and potassium in the body can drop. And the body is then unable to sustain healthy functions, including, of course, hair growth. The only time alcohol can help the hair is when we drench the hair in beer during a wash. Keeping the hair drenched in beer for a minute before you're rinsing it out, of course, with water, can actually help strengthen it. Anabolic steroids, which are a group of synthetic and natural steroid hormones that are used to promote muscle strength and growth. Testosterone, for example, is a steroid, but a natural one, an anabolic steroid. Well, this can also, those steroids, the artificial ones, can also be problematic and help your hair loss. The dihydrotestosterone, also known as DHT, is one of the primary hormones that is linked to male pattern baldness, and it has been shown that steroids accelerate the production of this DHT. When the amount of DHT increases in your system, this leads to hair loss, unfortunately, and it should be noted that balding due to an anabolic steroid happens if a male is already genetically predisposed to balding much more rapidly and is much more likely. So steroids only speed up this process. The hormone DHT binds to the receptors in the hair follicles, causing them to shrink, weaken, and die. A process known as miniaturization, and as a result, you become bald. Here are some other efficient homeopathic remedies that are great for baldness. Lycopodium calvatum. This is a natural medicine that is prepared from a plant named club moss, and it's usually the first choice of medicine for male pattern baldness. It helps to halt further progression of the hair loss and adds hair regrowth. So this again can vary from case to case in male pattern baldness, and its use is recommended when the hairline is receding and hair loss occurs from the scalp's sides, so the temple region. With this, dandruff may also be present with a foul smell that emanates from the scalp. Additionally, the scalp may be itchy, and you may even have a burning sensation that is present. This medicine can be used as a frontline treatment in any case of male pattern baldness. Its action prevents further hair loss and may also promote hair regrowth. This is mainly applicable to early stages of hair loss, but again varies from person to person. Though it can be used in low and high potencies, it is most frequently recommended in a 30C potency, and you should take it once per day for a month or two. Next we have Barita carb. It works well for male pattern baldness where hair loss is primarily visible on the crown or top of the scalp, so the vertex. And the scalp in these cases may be sensitive to touch, along with a crawling sensation. This medicine is mainly prescribed to manage male pattern baldness when the hair loss is prominent on the crown area, so on the top of the head. And most frequently it is advised to take it in a 30C concentration, again once or twice daily, depending on the severity of the complaint. Then we also have Silicea, that is beneficial for male pattern baldness in young males, where the males tend to experience hair loss very early in life. Also, in these cases, the males experience severe itching of the scalp. very often, and excessive sweating can occur on the scalp and can give a foul smell. The sensation of coldness can also be felt on the scalp. And males who experience hair loss very early, so in their teens and 20s, can be given this medicine to stop the progression of the hair loss. Recommended potency, here again 30, take it twice daily. There are also some great homeopathic remedies for hair loss caused by skin diseases, such as dandruff and fungus infections, as well as eczemas. The skin diseases of the scalp can lead to hair loss, as we have discussed, due to the excessive itching and acrid discharges from the lesions. And thankfully, we have various homeopathic remedies that can be used to treat such cases, such as psorinum. It's highly useful for treating hair loss due to eczematous skin lesions on the scalp that discharge sticky and very offensive fluid. These kind of discharges make the hair stick together, leading thereby to the hair getting tangled and ultimately destroyed. Additionally, the patient who requires psorinum feels excessive chills and desires to be warmly covered, even in the summer. Next, we have mesoreum, that is suitable for treating hair loss in cases where the hair is destroyed by the eczematous skin lesions of the scalp. The patients who require mesoreum will often complain of thick, crusty eruptions on the scalp, along with a discharge of thick, offensive pus that results in the matting of the hair and breeding of vermin in them, which eventually eat away the hair by bursts, and this leads, of course, to hair loss. Then we have Mercurius solubilis, another great homeopathic remedy that plays a beautiful role in treating hair loss due to eruptions on the scalp, where the discharge from the eruptions is fetid and accompanied by burning pains in the scalp. This medicine can be employed in patients with profuse perspiration, excessive salivation from the mouth, and an increased thirst for water. If the hair loss is due to dandruff, we have two other homeopathic remedies, namely Thuja occidentalis and Kali sulfuricum, that can be used. The point which will help decide which of the two is the preferred one is that the former, so Thuja occidentalis, is used when the dandruff is white, and Kali sulfuricum is used in cases where the dandruff is yellowish. Homeopathic remedies for treating hair loss in women after childbirth and during menopause are Natrum muriaticum, and Pulsatilla protensis. Those both are excellent remedies that are employed to treat cases of hair loss in women after childbirth. Natrum muriaticum can be given to those women who suffer from anemia and hair loss on even a slight touch of the hair, along with severe headaches after the delivery of the child. The women requiring this medicine often complain that their headache worsens when the sun shines on the head. The patients may also show an inordinate craving for salty things. Pulsatilla protensis can be used by women who suffer from excessive hair fall after delivery. The guiding factor for recommending this medicine is a complete absence of thirst for water and a desire for fresh open air. The mental symptoms to be considered for use are weeping tendencies on the slightest cause and relief when someone gives consolation. And another marked sign that guides its use in women suffering from hair loss is that such women cannot digest fatty foods very well. To tackle hair loss in women in the menopausal age group, the recommended homeopathic remedy is Sepia officinalis. It can be used as, and is being used very successfully because it promises beautiful results. The women that require this medicine for hair loss have a history of long-standing headaches often. Women in this group also complain of hot flushes followed by chills and perspiration and bearing down pains in the uterus at menopause, as well as hair loss. The mental symptoms that significantly can also indicate a usage of this medicine by women suffering from hair loss during the menopause are irritability of the utmost degree and indifferent behavior towards family members. There are also some great homeopathic remedies for hair loss in anemic patients, and those are borax, Cinchona officinalis, and Calcarea phosphorica. They are all equally good medicines that can be used to treat hair loss cases in anemic patients. Borax can be given to those who complain of hair loss and feel overall weak. A frequent complaint in those cases is also that their hair is very fragile and gets stuck together and forms bunches, making it difficult for them to be untangled and combed smooth, so they have to be cut off. But as soon as these bunches are cut off, another group of bunches forms. Cinchona officinalis can be given to patients with hair loss that is accompanied by anemia as well. People who suffer from hair loss due to loss of blood in any form, like bleeding from the nose or excessive bleeding during menstruation, or loss of blood after an injury due to an accident that leads to anemia, can all be given this medicine. And the patients who require this medicine also usually complain of weak digestion system and excessive flatulence. Calcarea phosphorica is yet another functional homeopathic medicine that can treat hair loss in anemic patients, usually in pale girls who grow too rapidly during puberty and suffer from hair loss, as well as extreme headaches, along with acidity in the stomach. Then we have homeopathic remedies for alopecia totalis, where the entire scalp loses its hair, and those are Silicea, Baryta carbonica, sulfur, and Lycopodium calvatum. The first one on the list, Silicea, is mainly given to patients who suffer from baldness and complain of pain in the head, usually on the right side, along with the hair loss. The patients who require this medicine are also susceptible to cold air and typically have very offensive sweat on their feet. Mentally, the patients are also very headstrong and obstinate. Baryta carbonica is yet another great homeopathic remedy on our list to treat baldness in young people specifically. The patients who require this medicine are often very timid, dull, and have a feeble memory. And they also often have a history of throat complaints like tonsillitis. Sulfur, yet another excellent homeopathic medicine that can be prescribed to those patients that suffer from baldness, that specifically are extremely hot-blooded and complain of excessive heat in the body, especially in the head, palms, and soles. Another symptom that guides the use of sulfur in baldness cases is that the patients have an aversion to bathing and are generally filthy, thus inviting plenty of long-standing skin diseases. And these patients also often show an extra craving for sweets in their food. Lycopodium calvatum, another excellent homeopathic remedy, is used to treat baldness cases that occur prematurely, and it can be also given to those patients who complain of some gastric troubles like flatulence, constipations, or liver problems along with their baldness. The patients who require Lycopodium calvatum usually also crave hot drinks, hot food, and sweet things. The most common types of alopecia are alopecia areata, telogen, effluvium, and drug-induced as well as androgenetic alopecia. The cycle of each follicle is independent of its neighbors and passes through three phases that we have discussed: the anagen that lasts for 3 to 5 years, the catagen, which is a short conversion phase, the telogen, the resting phase that can last for up to 3 months, after which the hair is shed. And one possible cause of alopecia areata has been suggested to be premature termination of the anagen phase, so the growth phase. Alopecia areata is sudden onset patchy hair loss in one or more circumscribed round or oval areas, primarily on the scalp. And the condition appears to have an immunological basis associated with autoimmune and atopic disorders. Although the exact pathogenesis has yet to be definitively identified, the disease is often related to emotional factors and endocrine dysfunction. Alopecia areata usually appears as patchy baldness, but occasionally causes all hair to fall out. And although total baldness is often permanent, regrowth is possible in cases with limited involvement. Telogen effluvium is characterized by the shedding of the hair rather than hair loss. It often follows an acute illness, surgery, pregnancy, can be caused by malnutrition, excessive dieting, blood loss, or severe psychological stress. The most common form is androgenetic, however, which includes male pattern baldness and diffuse female alopecia. Excess patterns are caused by excessive intake of spicy, hot, or fried food, or by depressed mental states that transform into fire, thus consuming the yin and the blood and generating wind due to blood heat. When we look at all of these problems of alopecia from a TCM perspective. The wind heat then follows the chi upwards to the vertex, preventing the hair root from being nourished by yin and the blood, and as a result, sudden loss of hair, yellow discoloration of the hair, or premature graying can result. Another excess pattern is caused by blood stasis in the hair orifices, and which deprives the hair root of nourishment by yin and the blood, and both manifest as unexpected hair loss. Overeating sweet and fatty food damages the spleen and the stomach, and this leads to internal accumulation of the damp heat. If this damp heat steams upward the vertex along the channels and attacks there the hair roots, the hair will thin or fall out. Blood stasis in the hair orifices, so the follicles, obstructs the movement of qi in the channels, making it difficult for new blood to irrigate and nourish the hair root, and thus leading also to rapid hair loss over a large area. Excess is one of the possible causes, and the other one in TCM for hair loss and baldness is a deficiency, such as a qi and blood deficiency or a liver and kidney yin deficiency that results in a lack of transformation and generation of sufficient qi and blood. The hair root is empty and the hair has no source of growth in these cases, and this leads to large areas of hair loss. Looseness of the pores in the scalp allows the external wind to attack, thus making the hair root less secure and depriving it of proper nourishment, resulting thereby in patches of hair loss. Qi and blood deficiency due to a prolonged illness or debilitation of the Chong and Ren vessels mean that the hair is also no longer appropriately nourished. This results in dryness and thinning, as well as lusterless hair, and eventually in hair loss. Internal damage due to emotions can also injure the heart and the spleen, impairing thereby the transformation and transportation function of the spleen, leading to loss of the transforming and generating qi and blood. This manifests in the exterior as gray hair and hair loss, and the interior as deficiency heat due to restlessness and overstrain. When the lung qi is abundant, this promotes the diffusion and distribution of body fluids and blood to nourish the zhang fu organs internally and moisten and enrich the skin, flesh, hair, and orifices externally. And therefore, damage to the lungs can also lead to various hair disorders, including the thinning of the hair, dry or gray hair, and hair loss. The kidneys, they store the jing, which is the life essence in Western medicine, or the bone marrow, and if this jing is deficient, the kidneys cannot transform and generate the yin and blood, causing thereby depletion of the source for generating hair. And this again results in hair loss or premature graying of the hair. Excessive sexual activity also can drain the kidney jing and damage the liver and the kidneys. A congenital deficiency of kidney qi is also responsible for the late growth of hair, thin hair, lusterless, dry, yellowing hair. And the highest incidence of alopecia occurs among the young and middle age. This disease, or umbrella of disease, they are characterized by the sudden appearance of one or several clearly defined round or oval patches of hair loss, generally 1 to 4 centimeters in size. An eyebrow, mustache, beard, axillary or genital hair loss may also occur in severe cases. Additionally, a few patients lose all of their hair on the scalp. This is known as alopecia totalis. Head and body baldness can also take place, and this is known as alopecia universalis. The skin is smooth and white or may have short stubs at the margins of the lesions, so-called exclamation mark hairs, about 4 millimeters in length and tapering towards the scalp. And the inflammation and scaling are absent. Hair loss may be accompanied by fine pitting of the nails also. New hair growth is usually the same color and texture of existing hair, but may be fine and white in these cases, particularly in older patients. And the outcome is variable. First episode usually results in regrowth within a few months. However, further attacks often result in more extensive patches of hair loss with slower regrowth. Let's look at some natural remedies that are recommended in TCM for hair loss and baldness. There are topical treatments and internal treatments. The combination of internal and external treatment here is Bao Fa Tang and Sheng Fa Bo. Topical treatments are alopecia topical formula number 3, Ji Yung Gao, alopecia topical formula 4, and the alopecia topical formula 5. Also Shu Xiao Ketu Ling Sheng Fa Jing. The She Fa Ding is hair generating tincture. And then we have the Gui Ji Ban Mao Ding. That is a preparation of cinnamon twigs and melabris, again a topical tincture. Then we have the Dong Chong Xiao Kao Ju, which is a cordyceps wine. Fresh slices of ginger rubbed onto the bald area also to produce a hot feeling 3 times per day. Powder of Chi Chong Wu is also used. It's mixed with vinegar or ginger juice and applied once a day to the balding area. Cordyceps can be used by itself. Yan Hu Shor tincture, it's called. It's applied to the affected area 3 to 5 times per day. Siemens sinapis, also known as BaiJG. It's a powder that is mixed with oil to form an ointment, and this can be applied to the affected area once per day. Psoralea tincture, known as Bu Gu Chi Ding, that can also be applied topically 3 times per day. 25% Xanthoxyli, also known as Chua tincture, is also recommended. A mix of powdered RX aconite, known as Chuan Wu, with vinegar can also be used. For hair loss with severe itching in children, we grind any amount of sinapis, known as BaiJZ, into a fine powder and mix it with enough lard or oil to form an ointment, and apply this ointment to the head daily. Some other topical patented TCM medicines are 101 hair regeneration alcohol, San Xian Dan, and He Shu Wu Wan. Another very effective natural treatment method that can be used to treat hair loss and baldness is acupuncture. And here you see all of the acupuncture points that need to be stimulated. I'm not going to go in detail through all of them. Suffice to say that we stimulate the spleen, the liver, and the kidneys mainly. With all that being said, I hope that I was able to give you an overview of the main causes of hair loss. And as you have seen, there are many possible ones. That's why before you start any type of treatment, you need to get a proper diagnosis. Again, please contact us at christine.doctor. Link is in the description box below, and we can do this for you remotely and develop the treatment plan that fits your needs, all holistic and all natural, of course. And as I've mentioned already, this list of natural solutions for hair loss and baldness is by no means exhaustive or exclusive. There are many other potent natural remedies that we also recommend, but this is already, I think, long enough, and we could be here for other 2 to 3 hours discussing all of the possible ones. What you need to know is simply this: your hair loss and baldness can be treated successfully without any harmful chemicals and side effects. If you have any questions, again, contact us at christine.doctor. Check out also some of the most powerful holistic health tools available on the market today at vibrantbody.net. Link is also in the description box below. If you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link in the description box below as always. And do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. Thank you very much for your attention, and until next time, stay healthy.